It's supposed to be in there. Yeah, okay, not the camera. Cut that. Do you have the button to share screen?
Share screen, host disabled. So you made me.
Do I make you able to?
Host, then I will make you host. Then I will. There are three dots on my face. So just
To multi-pin make host. Yeah, I gave you host. I gave you
did it.
host.
Still it's saying.
Host now? Yes. So you're now the host. Just record it now.
So now I will see.
So it doesn't bother you.
No, they're not bothering me at all. Don't worry. There it is. Recording. You are screen sharing. You are recording thing. The recording is on.
You can, if you don't want this.
No, it's okay for me. Recording is on. Yeah, if this one is saying the recording is on.
This is the share. I'm recording from my.
Okay, that's fine. That's fine. Record. Okay?
Yes. Thank you, sir.
No problem. Hi. Guys, can you hear me at the back? Today, if you see at the schedule, my name is not written there. It is Dr. Akef, but he requested me yesterday that I should take his session because he was a little bit busy, certain other activities. So I'll be taking and I'll be talking on his behalf. And today we'll be going over, I'm not saying going inside, we are going over the vascular system and the lymphatic system. It's a very long stretch. And I have tried to convert this activity into just an overview. I'll not be touching any of the details. I'll not be going any of the minutiae because over this whole year 1 and 2, you'll be learning the details. So if anybody is interested in going details, just wait. Just go slow and take, because the first thing is I'm trying to give you today a bird eye view, not the in-depth knowledge. Everything has, like I can see every slide needs is one complete lecture, but we are not doing that. Are we good? So, okay, let's start. So these are my objectives. You can read yourself. So now, this is an overview of the arterial system in a human, the venous system and the lymphatic system. These are the three things. These are the three broad images which supposed to be covered today. Just an overview. Something wrong? Now, when you look at a human body, any normal human, a male, what are we talking about? Vascular system. The story begins from an organ, which is a pump. And who's that organ? Is heart. So you need to be expected to be good at that. Where is this organ located in human body? And you have to be very clear. The in-depth details will be discussed in CVP block. And that will be coming up after your break. So the ribs has been shown, the other areas has been shown, and there are certain numbers and marks, but that is simply showing you the location of a normal heart. Now, this is an overall circuit within our body. Basically, heart is not one pump. We have a combo of two pumps, and they are working simultaneously. So let's start. You inhale, oxygen goes in, and then goes to your lung, and then the circulation of the blood. So blood is been coming from the lungs, which is rich with this oxygen which has been inhaled, and this oxygen-rich blood is being transferred to my heart. It has reached, and from the heart, it has been pushed to the body. There's a place, you can see with this human, there's a meshwork. So this is the capillary network. You can see something is red, that is the oxygen-rich, something blue, that is carbon dioxide-rich. So the blood, which has been pumped by my heart, is going to the upper part of my body and to the lower part of my body. For what? For bringing the nutrition, oxygen, because my each organ is dependent on oxygen. And from there, after that, the oxygen-rich blood carries the oxygen plus other nutrients. And after that, the carbon dioxide has been released, and it is being carried by the same blood. And it is going back from whole of my body, and it is going back to the heart. Which part of the right atrium of the heart is the receiving channel, and that receives all the deoxygenated blood from my upper part of the body and from my lower part of the body, as well as from heart itself. So blood has reached, which blood? Deoxygenated. Now I want to add on oxygen. So now a small pump. This was the action of a big pump. The heart was pushing for the whole body, for the each slightest, tiniest part of the human. The blood has been pushed. Now it has been returned. And now when this carbon dioxide rich blood has reached the heart, now heart is pumping again and pushing this blood towards the lung, where we have the gaseous exchange that occurs. And as a result, carbon dioxide has been released out. And this has been replaced by oxygen. And this cycle continues. No matter you're talking, you're sleeping, you're running, you're dancing, you're swimming, whatsoever, this is on. It never stops. So we have two circuits. One is the pulmonary and the other one is the systemic. Are we good so far? Now, when we look at the arterial system and the venous system, there are so many names which has been mentioned. The blood vessels, when they carry their journey, when they start their journey, they are big. And then they have a different architecture. This will be more discussed under microscope. And you can see the big artery goes to small and small and small till it becomes a capillary. And from that capillary, the venules, they start their journey, and small veins and veins and veins, and they go and ultimately open in my right atrium, the heart. Remember, arteries give branches. Something which is similar. We think these are the branches of the vein. They are not called branches. They are called tributaries. They tribute small, small veins joined to form a big vein. And a big veins, ultimately, there is a big reservoir, and ultimate job is to carry this oxygen depleted blood, carbon dioxide rich blood to the right atrium of the heart, and then the journey begins. Are we good so far? Now, look at it. Within my thoracic cavity, we have these two vital organs. There are so many other things, but this is of our concern today. So you're looking at two lungs, and in between, who's living is my heart. And everything is being wrapped in some layers. And these layers have certain names. The layers who are covering my lungs, they are given the name of pleura. And the layers who are covering my heart, they are called as pericardium. Similar kind of thing we'll find in GI. And there we call this stuff as peritoneum. So these terms are being used, and you'll be finding them in each block. Now, these are my right and left lungs. This is the pericardium, the covering of my heart. There are 3 layers. I'm not going in those details. And then this is the covering of my lung. We call it pleura. And now we are looking at a blue structure, and that is one of the biggest vein. I'm not saying the only biggest vein, one of the biggest vein, which carries deoxygenated blood from the upper part of my body, and we call it superior vena cava. That brings from my brain, from my neck, and partially from my upper extremity. And then this carbon dioxide rich blood is reaching to the right atrium of my heart through superior vena cava. When we use the term superior, it means there should be someone who must be called as inferior. But we are not showing it here at the moment. Now this is the place where heart narrows down. We call it apex of the heart. And if you want to look for where is your apex of the heart, just 5th intercostal space, rough landmark below the nipple, that is the landmark 4. But we have to be very precise. We have to be very specific. That's why we'll talk about intercostal spaces. And then we'll be talking about certain lines. These lines we'll be talking in more detail in cardiopulmonary block. Not here, mid-clavicular line, mid-axillary line, anterior axillary line, posterior axillary line. So there are so many vertically going lines. And these are specific. Now what I'm showing you on the left side, this is my pulmonary trunk. And this is the one which is responsible to carry the deoxygenated blood, which has been pushed from my heart, and it is going towards my lungs. And it's bifurcating, one for right, one for left. And then this arch-like red structure, where you can see this green dot, and this is my arch of aorta. From my heart, the arterial blood is being pushed into the ascending aorta. That becomes arched. We call it arch of aorta. Then it becomes descending aorta, then thoracic aorta, then abdominal aorta, then it bifurcates into common iliacs, and then internal and external iliacs. And from this arch of aorta, we have branches which are going to my upper part of the body and my upper limb. So that's a big distribution. So this is my aorta, arch of aorta. I'm not writing it here just for you. It's aorta. But aorta has certain parts. And then where this whole system resting upon, there's a partition, a muscular partition, which separates my abdominal cavity from my thoracic cavity. Don't think this is where your rib cage ends. That's the place where thoracic cavity ends. No. You know, the contents of the abdomen, they push deep in your cavity. Your liver is way high up. Now, let's look at the position and relation of the heart. For that, we have to take a section. Obviously, if a normal person is walking in your clinic, you are not allowed to cut someone. So, but we cut someone, we have to see inside. How we do it? CT scan, MR. Basically, what are they doing? They are cutting the human radiologically. So, and we have slices, and there's the techniques, and there are thicknesses, and this is everything is being observed. So when we slice someone transversely at the thorax, what we get? We get a section like this. Now we need to get ourselves oriented with this section, because the orientation of radiology is different. There is some physics involved. There is some, you know, the images you are learning in physics, inverted and those real and those kind of things are involved. So you need to have a little bit 3D type of thinking, not for today, for tomorrow. Usually right goes left, left goes right, and then you can say, why is you're showing it on the right side, it is on the right, left side. X-ray orientation, CT orientation, MR orientation, that's a different ball game. And people need to be, you'll be learning, we'll help you to learn these things. No, don't worry for that. Let's label this section. This is the basis of any CT scan. This is a transformation. If I show you a radiological image, it is exactly like that. Let's label it. This is anterior. This is posterior. The vertebra, the body of the vertebra is faced posteriorly. My chest bone, the sternum, it faces anteriorly. You can see these two bones here, very clearly visible within this section. Going further, this is the thoracic vertebra, because the section was taken in the thoracic cavity. And then you're looking at the right and the left lung. And this is within my heart, there is a partition which divides my heart, and which part of my heart? The ventricle into two halves, right and left ventricles. So this is my interventricular septum, a muscular partition which bifurcates my ventricles into right and left. And you can see very clearly both of these ventricles, their cavities has been shown. One is very muscular. The one which is very muscular, that one is working for the whole body. And one who has lower muscularity, that is good for push the blood towards the lung, because the journey is short. If I have to push the blood for the whole body at each capillary level, so I need to have a very strong pump. So you can see that the left ventricle, look at the musculature, it's very thick as compared to the right ventricle, which is very scanty, very thin. Are we good so far? Going further, so this is my pericardial cavity. And this chamber, the place where I put this dot, that is my left ventricle, the cavity of the left ventricle specifically. So this is an understanding of a sectioning, like how my heart is being organized within my thoracic cavity on a radiological perspective. Now, this is a real heart on a cadaver. This is a real picture, no fabrication, no drawings, a real image. Lungs has been removed. You can see the thoracic cavity. You can see the heart coverings has been removed. And this is the diaphragm. Look at it. Liver is pushed almost into the thoracic cavity. On the left side, there is stomach. But this is more coming within my thoracic cavity, from where we have removed the right lung, and this is from where we have removed the left lung. And this is the heart, this is its apex. And you can see certain other structures, and you can see these great vessels. What are these great vessels? You're looking at superior vena cava, you're looking at the aorta and other things. I'm not going in details. I can show you some more real image of a human heart. This is it. This is a real one. That is also a real one, but that is on a cadaver. Look at it, pericardium. With the sutures, we have just tucked it open. So now you can see a real heart in a real situation. Only person is sleeping. Okay, now, coverings of the heart. There's a concept, pericardium. Just an overview. To understand that, I bring a balloon for you. It's purple. I don't know what is the meaning of purple balloon, but it's a balloon. And why I'm bringing it here? Just to show you the understanding. Pericardium, pleura, peritoneum. When you will be learning, it has a serous layer, it has a parietal layer, and it has a visceral layer. But in reality, that's one layer. How? Let's see. I'm pushing my fist within this balloon. Look at it. My fist has gone in. Is it inside the balloon? What I did? I pushed in. So let's see how I pushed in. So the part of the balloon which is covering my fist, I give it a name. I call it, it's close to the organ. Organ is viscera. So we call it visceral pericardium. And then the outer layer, which is facing the body cavity, the red one, that is my parietal layer. So the visceral layer and parietal layer. It's one thing, but we pushed inside, so we have created. Now the space in between, I drop a location here. The space in between this blue and red, that is a cavity, and we call it pericardial cavity. This pericardial cavity had a fluid, which is lubricant. It's very tiny, few mils, not liters. And the job of this cavity and job of this fluid is to facilitate my heart is moving every second. Friction, it's moving. So I don't need any kind of friction. So to minimize that, there's a lube in, and that is pericardial fluid. Are we good so far? Yes, Faisal. You have to go to the mic. Why don't you bend down yourself? Yeah. Does it ever happen you went to some lube station in some mustashfa that put some fluid? I think my gauge is showing the fluid is low. There is an automatic system, it's been created. It's continuously been made. As much you need, it's been there. And every cavity gets its required lubes and fluids, because our joints, we don't need to get them re-lubed or any kind of things. Are we good so far otherwise? Yes. No. The job is a lubricant, and primarily it facilitates frictionless movement. Okay, now let's do a little bit. This is a little tricky slide. If you don't understand it, ignore it. But I'm showing you a heart has been cut, and we are looking at its different layers. Labels are there. And then we are focusing at this angle. I made a cut here, and through this cut, I'm trying to show you, I'm zooming in this space, and you can see there's a fold. We were talking about it with my fist. Heart is like my fist. And can you see that? The balloon has been folded on itself. If I say the inner one was blue and outer one was red, and we learned that the inner one was the visceral layer and outer one was the parietal layer. So now this is the pericardial cavity, and then the pericardium outside is a fibrous layer. My heart has primarily two layers. The first layer, the outer core, is fibrous. The inner core is serous. Serous core is further divided into visceral and parietal. So this is the outer core, then you have the serous layer, and then you have the epicardium. Did I say that? I'm talking on the top, and why are you bringing the bottom here first? Man, we will talk about this. Don't get into that discussion, because then I have to talk about the pleuropericardial membranes, the septum transversum, and those kind of things. So it's a big, long discussion. You have to speak loud if you want me to answer you. Hand is this. Hand is this. This pinkish thing is hand. And these are the two layers of the same bird. Visceral and parietal. The one layer which is close to the heart, that is visceral. One which is outside, that is parietal. We'll be spending good time on that. Relax, gentlemen, no problem. Okay, now this is the heart. Yes. Serous layer becomes visceral and parietal. Fibrous is fibrous. So now let's look at a heart, and I'm trying to show you the branches which are coming from my arch of aorta. So you can see that there are three main branches which has been shown. And as I told you, there is an ascending part of the aorta, arch, and there is a descending part. And then from the right side, I have one common artery, that is my brachiocephalic trunk. But on the left side, the pattern is different. There are two direct branches, and my brachiocephalic trunk further bifurcates into name. Let's see. So on the right side, I have one big, and then it becomes subclavian for my upper limb, right upper limb, and my right part of my chest wall. And on the other side, I have direct branches. Now you may have a question why this is happening. Yes, you'll be answer this question when in CVP block, when you'll be coming after your break somewhere in Jan. There is some Paul will be talking about the the fate of these arteries, and then there are certain arches. So someone disappears, someone there, someone is not there. So that is coming after. But simply you need to remember the arch of aorta primarily gives three major branches. On the right side, you had the brachiocephalic trunk, which becomes right common carotid, which goes to my head and neck, and right subclavian. But for the left side, I have left common carotid coming directly from the arch, left subclavian coming from the heart. So now there are these tiny arteries which are coming from my ending. They are supplying the heart. See, heart has blood. The whole body blood goes to the heart, but this blood doesn't give anything to my heart. So for the supplying of the muscles of the heart, I need blood itself, oxygen-rich blood, and that is being supplied by these coronary arteries. And the coronary arteries, only right has been shown to you, even left is visible, but it is not been marked here. And and down you get a hole in the diaphragm, and through that hole, my abdominal aorta is passed going to the cavity of the abdomen. Yes. They are emerging from my ascending aorta. There are sinuses. There are more details, but not talking today. Are we good so far? There's a hole in the diaphragm, and this hole transmits the abdominal aorta. And this is, you're looking at the abdominal aorta, which is going to supply the everything in my lower limbs. Are we good so far? Okay, now, this is what has been explained in this image, how the deoxygenated blood coming to the heart, and step by step, everything is being numbered. Where is the oxygenated? Is the oxygenated? See, if these different. This one showing you the oxygen, and the red one is showing you the flow of the oxygen-rich blood. Remember, this is the same. We don't think this is a dirty blood. This is the clean blood. Only the blood which is rich with oxygen, we call it, that is being shown with the red, and the one which is rich with the carbon dioxide, still it has some oxygen. That has been shown with the blue, and you can read through. Now, coronary, very common problem. Someone has a heart attack. What happened? What went wrong? People are living with not a healthy lifestyle, not taking care of themselves. As a result, the arteries get clogged. They become narrowed. Process is atherosclerosis. Similar effect come to the body. So the arteries who are supplying oxygen-rich blood to my heart, they get clogged. Once they get clogged, less blood is reaching to my heart. When less blood is reaching to my heart, people start having pain, angina, and MI is one of the sequelae. So how we see it? There is a technique. Make a contrast. That angiography is a special type of technique, and you can see that how this meshwork, this whitely showing stuff, all these coronary arteries and their branches, how they are making a meshwork around my heart through its right and left coronary arteries. Are we good so far? Now, what is happening here? ECG, wow. So someone is being in a technique, and there you are looking at, this is the recording. What are you recording? The electrical activity of my heart. So, do we have some power supply? SA node, excellent. So this is where my SA node. And who control my SA node? I love your answer. Who supplies blood to my liver? Heart. What is your name? Human. This answer will be read like this. Where you live in this world? What do you eat? Food. So give me an answer. Brain, wow. Didn't we talk about autonomic nervous system? Didn't we talk about parasympathetic and sympathetic? From them, the stimulus come to my SA node. SA node is activated. Then there are so many branching pattern. Then it goes to AV node, and then AV node. So there's a complete electrical impulse which occurs within a heart. And these are the steps for that. But someone whose heart is failed, what you'll do? The autonomics are not working. SA node is not working. So there is no electrical activity in my heart. If there is no electrical activity, heart will not work. Heart will stop. And heart will stop, the person is gone. Artificial electric pulses. So you give a DFAB every minute. Pacemaker, that's the key word. How a pacemaker? Let's look at the pacemaker. This is on X-ray. You can see this red thing. That pacemaker. This is a location, and there's a wire which goes to my right atrium of the heart. And this pacemaker is a battery-like thing. And if someone is wearing a pacemaker, and if you're going through a security check, TSA, you have to mention, otherwise a big sound will come, and everybody will be at alert. What the hell? Who's going on? What weaponry is there? So this pacemaker, some people live with this pacemaker. Who are these people? Who have failure of their heart. So as an emergency procedure, under the skin, we insert this battery. You can see this red color battery here. So this battery is being inserted. I think this, my view should be out. Yeah. So this is the pacemaker, and look at it. Pacemaker is, I'll be coming to you. Pacemaker is here, and this, look, the wire, the connection, which carries, because there is a failure. Yes, who was asking something? Normal human who's like you and me, we don't need a pacemaker. But once God forbidden, if our heart fails and we reach to a level, so in emergency, physician put a pacemaker, they make a small cut in your skin, they insert this and they push this tube that goes to your right atrium, and once it's a battery thing, but don't ask when you replace the battery. It has a lot, quite long battery. It's not like you have to replace the cells. So it continually giving the impulses, and then everything is taken care of. Pacemaker, this person has to live with pacemaker, because how the rest of the life, whatsoever is remaining, until you are off. I think when you guys will be coming to the dissection labs, yeah, it is a device. When you'll be coming to dissection labs, I have so many cadavers who had pacemakers, and I think few of them are with me, so I can show you in reality how this pacemaker and where it's been placed. Don't worry, relax. Okay, now. So now there is another system which my brain controls. Your blood pressure goes high, you become angry. So there is a system which is automatic. You need not to turn on a switch. Oh, my blood pressure is high, so I need to go relax. So there is an automatic system, and this whole mechanism come in play. Now, what happens in my lung? The pulmonary circuit. This is inside of a lung, and there you can see this is the place where gaseous exchange is occurring. You can see these oxygen-rich and carbon dioxide-rich vessels, and you can see within this place, which has been highlighted, inside that, the carbon dioxide and oxygen has been replaced with each other. Now, the complete arterial plan of a human, major system, major arteries, let's look at it, my brain. This is my brain. What has been removed? The only within the skull, the soft tissue has been removed. These are only the meshwork of arteries which have been placed within my brain. And look at it, how rich is this? And once they are clogged, person goes off. And these are the arteries of my head and neck, and we talk about that, right and left common carotids. And this is, they are going to the brain, supplying to the face, supplying to the neck. These are the upper limb. As you'll be doing MSK shortly, so look at it. Subclavian becomes axillary, brachial, radial, and ulnar. There are else, but just to show you the arterial plan in hand. Now, within my abdomen, this is the plan. One of the arteries, superior mesenteric artery, and look at the intestines. I told you today I'll be just skimming through. Abdominal aorta, how and it supplies. Abdominal aorta has so many pattern of branches, paired, unpaired, visceral, long names. The major arteries are different. And then you can see pattern with the head and neck, brain. Now, veins have a different mechanism. We have a superficial set of veins and we have a deep set of veins. And these set of veins are interconnected with each other. And you can see there is a color difference. Superficial and deep one is purple and one is blue. Deep vein and the light vein color. I like your question. Artery, there is a pulsation. Artery, there is a pulsation. Vein, quite simple. That's why when you visit a doctor, he always put your hand and you can do it. Something is jumping and wherever you want to access your arteries. So arteries are pulsatile. Veins are not pulsatile. So now the veins of the abdomen, you can see that inferior vena cava, how it's formed, renal veins and everything is going ultimately. Hepatic portal system. These are the different veins. So my question is, what is a portal vein? Any idea? I cannot hear you. Guys, can you hear him? No. So you have to loud. Come with a good breakfast. The veins that take blood away from the liver. Any other idea, gentlemen? You are raising your hand, yes? Same. Mafi South. Okay, let's take other vein. Vein never supplies, vein receives. No, nothing cavity to cavity. Waste, okay. There is no waste management, yes. So any ordinary vein does this? Okay. Can you speak loud? What she say? Who's saying yes? Can you repeat it? Speak loud. You're Lara, why don't you go to mic and speak in the mic? You're sitting next to it and you're not talking. Yes. Answer has been given. Only the issue was the loudness. Let me resolve it. What she gave, a vein, this is a vein. All other veins, they stay and they end up in heart. But this portal vein is a different, because this vein is not only carrying deoxygenated blood, it carries nutrients we eat, been absorbed from my intestine. And if I send it to the heart, what is the purpose? It goes to the manufacturing unit, and that is the liver. So portal vein is the vein which does not go to the heart directly. It goes and opens into another organ. It drains itself there, and then it is reformed, and then it's connecting with the main venous system. So this is a difference in a normal a systemic vein and a portal vein. Okay, guys, now little quick recap. So this is a section, a human body section, and we are looking at different layers. So let me label the things for you. This part is the skin. This is the real picture of a cadaver. This is the superficial fascia, deep fascia, muscles. This is how our body is organized. No matter whatsoever is your race, color, or. And these are the bone section from where? From my tibia and fibula, means leg. What is fascia? I think wait for Oni and they will be explaining about fascia, connective tissue, these. These are basically wraps. And now what are these? We call it neurovascular bundle. It has artery, vein, and nerve. This is, I'm talking about an overall organization. Now, what are these? Superficial veins and picture. And what about this? Deep vein. Now, this is a neurovascular. Let's zoom in. Now you can see it has nerves, it has an artery, but there are two veins. Deep veins are always, in the major veins, always double. We call them vena comitans. and they are always surrounding the artery. These are the vena comitans. Now the same thing which we were looking at, and with valves. So blood should not be returning back to prevent backflow. Thank you. So now this is a conceptual slide. I'm taking, let's say this is an example of your leg. This is the main artery of the leg. It can be any name. I'm not going for the names. This artery is being surrounded by vena comitans. We have just seen them. Why we call them vena comitans? Because they are connected and they are paired. And then everything is in a wrap. And then they all are present within the skeletal muscles. And then the skeletal muscles are surrounded by deep fascia. And then that is embedded within the superficial fascia, which has a membranous layer and a fairy layer. And then we have superficial veins. When you do more workouts, your veins in the arm, forearm become very prominent. What happened? Basically, your fat is gone. That's why these veins become visible, meaning the muscles become hypertrophied and the fat has been burned out. So now these veins are visible. And then these veins are connected. Superficial veins are connected with the deep veins. And we know that there are valves. Now what happens? Once these valves, they fail. This is the normal flow. Let's see first the normal flow. Let's unreveal. So now you're doing some activity. Your artery is pulsating, you're running, you're doing something, so your artery is pulsating. As a result, now look at the muscle, what happens? They are also been compressing, so there's a push on, and as a result, internally artery is pulsating. From outwards, because you're using your muscles, so muscles are contracting, so you're squeezing upon these veins. What veins? Vena comitans. So whatsoever blood is present in these veins has been pushed upwards. So our heart is not sucking blood. Blood is being pushed towards the heart. And once this blood is being pushed, so from this superficial vein to the deep veins, the blood is flowing. And it will not be going back because there are valves. Now, valves are destroyed for reasons. Now what happens? The blood is not going into the deeper system. It's coming back. When there is a more activity, blood is coming into the superficial system. Now the superficial veins, they show this type of pattern. This type of pattern is being visible, and these are called varicose veins. And when this person, look at it, this is the same thing. When this person will come to you, this is how he'll be your leg, his leg to you. What do you think? Then what is this? Lymphedema. And what about this leg? Varicose veins. So you're looking at the lymphedema and the varicose veins. So you can see the difference. And why these veins become visible? Because the valves have destroyed. So the blood is coming within the superficial veins. And who are the people who get this? Those who stand a lot. Thank you very much. And who are the people? Security guards, surgeons, teachers, salespeople, those who have long-standing jobs. Yes. How about? My gentleman, bring it down and then. Pregnant woman, that is a different story because there is a baby inside that is causing pressure, but that's a different story. But right now, this is like, they don't need any pregnancy. If you are, that's why you have seen that these security guards, their jobs is 4 hours, then they are sent back. Then someone else is replacing. Yes. I'll borrow two slots from physiology, and then I can able to do that. It's not the time for that. What's the? If you are standing a lot, you're always in a situation, so there is a chance. It's not like everybody who's standing should have a varicose veins. Mostly it has been seen those people who have prolonged standing. The reason is prolonged standing, all the time these valves are under stress. You're using something more. There are more chances of destruction. If you're driving your car, maybe 10 miles in a month, will there be a problem? If you're driving 100 miles in half of the day, and then there will be more wear and tear in your car. How can you repair these valves? Yes, there are surgical procedures. There are so many things, and a lot of science is involved. Yes. Diwali, yes. In Arabic, you call it Diwali, but this Diwali is for the legs, is this. Then there's a Diwali for the testes, and that is for infertility. We'll be talking in renal block. Don't worry for that. So Diwali and varicose vein is the same word. Same. Are we good so far? Okay, guys. Now I'll be talking about the lymphatic system. What is the lymphatic system? What is your overall idea? What is an overall idea about lymphatics? You can bring it down, speak. Guys, simply remember this way. Simply remember this way. Yes, Ragaz, but you have to speak loud. Part of the immune system, so many people have said it, but they want to know the big picture. My body is many tissues. Guys, let me give you a very simple example. You all are living in Riyadh. The water has been, which you are using in your restrooms and kitchen, and that has been pumped from Dammam. So the big pump is sitting where in Dammam? From the sea. They take the blood, they desalinate it, and then this water is pushed for Riyadh. So that is the arterial system. Big channels, they bring this water to the city Riyadh. And from here, the big, smaller. So these are the branches. They are coming to your homes. And within your home, you are having different taps in different locations. So that is an example of arterial system. Then within your restrooms, hammam, toilet, you have an area where you wash your hands, and there's an area where you go for feces and other things. They are separate channels. So the small channels of the wastewater, they join to form a big drainage, and this drainage ultimately go out. That is an example for venous system. So in human body, what happens? The oxygenated blood comes, supplies, then is returned as a deoxygenated blood. But not all the blood will be returning. Some of the blood is leaked down into the tissues, and that is in the form of lymphatics. So this fluid, which has been leaked down into my tissue, that has been collected by this lymphatic system. Then it's going to the lymph nodes. Then we have lymphatic organs. There it's been recycled. It's been filtered. And then ultimately, this fluid is poured again into the vein. So my balance is the 6A, excuse me. Let's say I have a net of 7 liters. So 7 liters will remain the same. Heart is pushing 7 liters. Like 3/4 is coming through the veins, the remaining coming through the lymphatic. These systems are interlinked, interconnected. And look at it, how they are closely associated. So the normal circulation, we talk about it. Now, whatsoever is the leakage, that leakage is carried by these green channels. And look at their small stations. These stations are lymph nodes. Then they are going to the major lymphoid organs, and ultimately is being connected to my venous system. So this is coming to my veins, ultimately. And these are the lymphatic system. This green one is shown in my cavity, and a picture of that. And these are my major lymphoid organs. You can see the spleen, thymus, and the bone marrow. These are you are talking about immunity, all those things. So these green dot seed-like things, these my whole lymphatic system interconnected. And you can see the cycling and the lymphoid organs. Your tonsils are lymphoid organs. Within your intestine, you have lymphoid fire patches. So there are so many things. So all those things are the lymphoid ones. So you can see their location. They are located in different parts of human body. And ultimately, this image is showing you a broad picture of a lymph node. Lymph node is a small unit, and then ultimately this lymph is going and finalized. When it's cleared, then it's being poured back into the venous system. Are we good so far? You speak loud. No. What happens? The fluid, the tissue which has been released, the blood which has been released, the fluid which has been released into the tissue, it is being carried by small lymphatic channels going to the lymph nodes. These lymph nodes are ultimately going to one big channel, which is in the abdomen. We call it cisterna chyli, and this cisterna chyli continues as a thoracic duct. And then it drains into, on the left side, into my subclavian. Right side has a separate drainage. So there is only two locations for the connection between the venous system and the lymphatic system. So guys, this picture is showing you a summary of how the different arteries are branching and everything is going up. And the venous systems, how they are joining and draining. You'll be learning over 2 years. Don't worry. It's not 1 hour job. Thank you very much. So now it's the attendance time. Notice.